Alright, we are going to go over how to set up a PCA pump. So of course we're going to verify our orders and check all of that. This video we're just going to focus on how to set up our tubing, to prime our lines, and how to attach it to the patient. So first we need a PCA key to unlock both the lockbox and the pump itself. And to turn the pump on, we're going to push the side button. We'll wait for it to turn on here. So we are starting a new patient. I don't know if you can read that on there, but we're going to hit yes. We have a new patient. Now it's going to ask us a few different things here. It's going to ask if we are doing a standard PCA, if we have a palliative care, if we have an epidural. So if it's an epidural, anesthesia should be setting that up. We shouldn't have to set the pump up initially. For PCA standard, those would be our standard dosages. However, if a patient is at the end of their life on hospice care and we're giving them more medication than recommended for just a standard patient, we may have to scroll down and put palliative care oncology to be able to select the dosage that we want. But in this case, we're just going to do PCA standard, analgesia, and then we'll be able to pick which drug. So we have our Dilaudid, morphine, and fentanyl depending on what the order is. We're going to say that we have Dilaudid. So the code to get into the pump is 150. So we're going to enter that. And it's going to ask us if those settings that we selected are correct. We're going to hit yes. And of course, our nurse witness will also be checking this with us. Okay. So now we can continue to set things up, but I'm going to get my tubing ready first. So we do need primary tubing, our CADD tubing. So the CADD administration set is what you want to look for in the blue bin room to hook things up. Then we're going to pretend that this is some Dilaudid that I just got from the pharmacy. I don't have an extra bag, so we had to work with what we had here. So I'm going to take the CADD administration tubing and I'm going to go ahead and spike my bag. And there's a little hanger in the lockbox for that medication to go. So on the tubing we have this little cassette, this blue piece. Just going to take off and throw away. And then you can see that there's these two legs on one side. Those attach to the bottom of the pump. So there is a little spot. You kind of have to look upside down to be able to attach them, which isn't ideal, but it should snap in place. And then you can lock that up. The pump will tell you if it doesn't recognize that that's in there. I'm gonna go exit. I'm gonna hit prime tubing, yes, and prime. I'm gonna take the cap off the end, and then I'm gonna wait for my tubing to prime. Now I'm going to prime it only until it gets to this Y site. So once I see it here, which I do, I'm gonna hit stop priming. Because I know that I'm going to hook up my fluids to here. So I always learned fluids filter. So you can see that there's a filter on here. I'm going to attach my fluids to here. The cap that I took off the end, this is going to go to the patient, so we want to make sure that we're not touching anything with this. So the reason that I only primed it with the medication until this Y site is because I don't want to risk accidentally overdosing my patient. So if you prime it all the way through this tubing and it doesn't get flushed out with fluid, then you could overdose the patient because they're getting this much extra of medication. So that's why I always prime it with the fluids. So there should always be a fluid order, or you could attach a flush also if you wanted, but the fluids have to get attached anyway, so I always do just hook up the fluids and do it that way. So now I'm going to hook up my primary set and attach it to the filter fluid, and any additional medication that you may have accidentally primed in this part of the tubing should get flushed out when you prime your primary set. So now that I have primed the tubing with the medication, I'm going to go ahead and take this blue cap off, hook my fluids up, my primary tubing with my fluids, and really this, I'm just using some old expired tubing, but really this should be portless tubing. Any PCA should have its own line. That line should be dedicated for that medication only. So we should use portless tubing so we're not mixing anything in with that drug. And then I'll go ahead and prime that. And any extra medication will be flushed out if you did accidentally prime the Dilaudid past that Y site. Okay, so now our tubing is all primed with both the medication and the fluid, so we can go ahead and attach this to the patient, making sure that our clamps are still on because we don't want to run anything yet. Depending on the doctor's order, you can go ahead and then program the IV pump with your primary line as well. If it's just TKO or whatever fluid rate is ordered, you'll go ahead and do that. All right, so this is attached to the patient. Our fluids, we're going to say that pump is programmed, and then we can go ahead and check our order and make sure that we're programming the pump appropriately. So we'll go ahead and adjust our settings. Again, the code to get into here is 150, and you'll see that there's soft and hard limits. If the pump thinks that you're giving too much or too little, it'll be red. And if you're in the green, that's like the standard. So we're going to say this patient can have, we'll just say 0.1 of Dilaudid continuously. Sometimes there isn't a continuous rate, so you just have to look at the order. And the PCA dose will say 0.2 every 15. So we'll just keep the standard ones, but you can change those. And then once you have gone through all of those things, you want to make sure that the nurse that's verifying this with you is approving it. So once you have all of it programmed and you hit start, you will have this, it'll come up again, and then you'll have where you can accept the value, and then you'll get green check marks by each thing. So that's just to do your double check with the nurse. And then we'll hit next, and this will say is already hooked up to the patient, and start pump, yes. So now our pump should be running. We want to make sure that everything is locked before we go. So lock the pump. It won't start without it being locked. We'll lock the lock box. Make sure that our patient can reach the button, PCA button, which is hiding somewhere over here. And then also we want to make sure that we're charting on this every 2 hours and assessing it every 2 hours. So if you want to see how often the patient is pushing it and how much they've got, you can hit reports and you can view that information. And then also under tasks, let's say you want to give a bolus through here, The first option under tasks is give a clinician bolus, and the passcode for that is 777. So you can put that information in. You just have to make sure you're scanning it and that the MAR is reflecting that you gave that. So there should still be an order to do that. All right, that's it. If you have any questions, let your UBE or leader know.